corticosteroids, are medicines that help reduce inflammation in the body. Inflammation is your body's natural defense mechanism. It happens when your immune system detects a problem, like an injury, infection, or harmful substance. The immune system sends out signals to repair damage and fight off threats, causing classic symptoms of inflammation. While inflammation is helpful in small amounts, it can sometimes go overboard. When this happens, chronic inflammation can cause ongoing pain and damage to tissues. It can mistakenly attack your own body. There are certain health conditions where an overreactive immune system plays a role, including skin rashes and joint problems. Therefore, steroid medication is helpful in these conditions. They're different from anabolic steroids, which are often used illegally by some people to increase their muscle mass. How do steroids work? Think of steroids as a copy of hormones your body naturally makes. Your adrenal glands, which sit on top of your kidneys, produce the hormone cortisol. However, in an overreactive immune response, a higher level of steroid is needed. Therefore, man-made steroids work efficiently by calming down overactive inflammation in your body. They suppress your immune system, leading to the resolution of pain and swelling. Different types of steroids can come in many forms, each designed for specific health problems. The main types are by mouth. Tablets, capsules, or syrups help treat the inflammation and pain associated with certain chronic conditions, such as rheumatoid arthritis and lupus. By inhaler and intranasal spray, these forms help control inflammation associated with asthma and nasal allergies. Topically, creams and ointments can help heal many skin conditions. By injection, this form is often used to treat muscle and joint symptoms, such as the pain and inflammation of tendinitis. Most steroids are only available on prescription, but a few, such as some creams or nasal sprays, can be bought from pharmacies and shops. What about side effects? Steroids do not tend to cause significant side effects if they are taken for a short time, around 2 weeks, or at a low dose. Steroids taken by mouth affect your entire body. For this reason, they are the most likely type of corticosteroid to cause side effects. These can include high blood pressure, which can strain your heart, changes in mood or behavior, like feeling irritable or confused, stomach issues, like nausea or upset stomach, increased appetite, leading to weight gain, especially in your belly, face, and neck. Over time, long-term use can lead to more serious effects: eye problems like cataracts or glaucoma, diabetes, weakened bones, osteoporosis, increasing the risk of fractures. Long-term steroid use weakens the immune system by suppressing the body's natural inflammatory response. Over time, the body becomes less capable of fighting off bacteria, viruses, and fungi, making people more susceptible to common illnesses like colds, flu. Inhaled steroids can sometimes leave medication in your mouth or throat, leading to oral thrush, a fungal infection in the mouth, hoarseness, or a scratchy voice. You can reduce these effects by rinsing your mouth with water after using your inhaler, but don't swallow the water. Topical steroids, creams, and ointments. Applying steroids on the skin can cause thinning skin, making it more fragile. Steroid injections. Steroid shots can cause temporary side effects like skin thinning, loss of color in the skin, and intense pain. This pain is known as post-injection flare. Here are some tips to get the benefits of steroids while keeping risk low. 1. Start low and go slow. Ask your doctor about starting with the lowest possible dose or taking steroids every other day instead of daily. 2. Use non-oral forms. Inhalers or creams can target specific areas and reduce exposure to the rest of your body. 3. Support bone health. Long-term steroid use can weaken your bones. Talk to your doctor about taking calcium and vitamin D supplements. 4. Don't stop suddenly. If you've been on steroids for a while, your body may need time to adjust when you stop. If you take oral corticosteroids for a long time, your adrenal glands may produce less of their natural steroid hormones. To give your adrenal glands time to recover this function, your provider may reduce your dose gradually. If the dosage is reduced too quickly, your adrenal glands may not have time to recover, and you may experience fatigue, body aches, and lightheadedness. The bottom line, steroids can be life-changing for people with certain medical conditions, but they're not without risks. Always follow your doctor's advice and ask questions if you're unsure. When used carefully, steroids can be a powerful tool for improving your health and quality of life.